Insurance, we take good care of you, guaranteeing you peace of mind. You're always safe with us.
Come, build with us at Hostels Building and Nevis Centers. We don't just sell materials, we help you build your dreams. Whether it's a new home, a renovation, or a DIY project, we're here to make it happen. That's why we say, build with us. From foundation to finish, come to our stores where we have the best in building materials, hardware, tools, paints, expert advice, and more. Whatever you need, you can count on us. So if you're ready to get started, build with us. With Hostels Building and Nevis Centers, you're not just building a structure, you're building a future. Let us help you create something amazing. Dream with us, plan with us, grow with us, build with us. Come build with us at Hostels Building and Nevis Centers today. Build with us at Hostels.
Better prices, better quality. Check Brown. Better shopping for you. Best value for your money. Check Brown. Better prices, better than the rest. Brown, the good food people. At Brown to get the best.
Grab a Vitamalt, a natural, non-alcoholic malt drink packed with health, energy, and vitality. Vitamalt contains important B vitamins. Do you want a healthy lifestyle? Then grab a Vitamalt now. Vitamalt takes care of you.
And a pleasant good day to you. As you know, as always, whenever you hear my voice first up, it means that Hortensia won't be in today, and she also won't be in tomorrow, but she will be in on Monday, Tuesday, on Wednesday, okay? So you'll be stuck with me and my masculine, monotonous tone, lacking the feminine part to sort of balance things out. But hey, I think we can cope until she is back here. How are you today? Hope fine. Hope that everything has started well and will continue in that vein. Today, what are we going to do? Well, I don't know exactly, but what I can say, if you feel at any time that you wish to call in, have something to say, then feel free to do so. I'll give you the numbers in a bit because I don't know them right out of my head. But if you remember the numbers yourself, then feel free to give us a call and express yourself on whatever topic, whatever it is that you feel is worth your discussion or perusal. Okay, let me go back to the theme a bit so that I can get a bit of information, and I'll be right back at you. Okay, I'm back with that bit of information as it relates to the telephone numbers. Like I said, don't know them out of my head. As a matter of fact, I don't even know my own telephone number straight out of my head. The numbers are 466-0989, 662-0989, 762-0989. In the UK, 033-344-0065. In the US of A, 718-285-6984. And in Canada, 305-921-4619. Bear in mind that not all of those numbers would be working, but if you try one and you don't get through, feel free to try another, and you will most likely be able to get you on some one or two of those lines. If you've been wondering why we've been sort of intermittently off, and last evening we were off, our animated system is presently down, and it would seem that we would have to get an entirely new animated system, automated system that functions when someone isn't here, or even if you're here in studio, that system that, makes it easy to access the news and the ads and the various other stuff, that is presently down. It has been going through some ailments of late. It is presently down, and we're hoping that that could be rectified sooner rather than later. Until then, you might just be hearing us in the early morning up until the afternoon, and then most likely we would be off in the evening and night times until we get that rectified. Okay, now let me see what I'm going to do here. I'm going to see if I can find me a clip to play to start things this morning, and I'm going to sort of move away from a lot of the heavy topics and play a clip that deals with 10 things or 10 lies told about the African continent. Okay, so you can give that a listen. Relax as we get deeper into Island Tea. Don't forget that at 1:30 we'll have a rebroadcasting of Weekly Dose with Dr. Natalie Osborne, okay? So at that time we'll segue into Weekly Dose, but up until then, let's get into playing a clip or two or having you interact whenever you feel like doing so.
For years, the West has spread myths about Africa. Let's debunk 10 of the biggest lies. Lie number 1, Africa is a country. Africa is a continent with 54 countries, each with unique cultures, languages, and histories. Lie number 2, Africa is poor. Africa is rich in resources from gold and oil to tech startups and a booming economy. Countries like Nigeria, South Africa, and Kenya have multi-billion-dollar industries. Lie number 3, Africans live in huts. Yes, traditional homes exist, but Africa has modern cities like Nairobi, Lagos, and Johannesburg with skyscrapers, highways, and high-tech hubs. Lie number 4, Africa is unsafe. While some regions face conflicts, Africa is home to some of the world's safest places, including Botswana, Rwanda, and Mauritius. Lie number 5, Africa contributes nothing to science. Africans invented mathematics, astronomy, and medicine long before colonization. Today, African scientists and engineers are making global breakthroughs. Lie number 6, Africa needs saving. The idea that Africa needs saving ignores the fact that Africans are building their own futures, leading in business, tech, and governance. Lie number 7, Africans don't speak English or French. Many Africans are multilingual, speaking local languages and global ones like English, French, Portuguese, and Arabic. Lie number 8, Africa has no history. From the great Zimbabwe ruins to the Mali Empire, Africa's history is rich and deep, dating back thousands of years. Before I reveal the last 2 big lies about Africa, I'm kindly asking you to like this video to help Africarized reach more people. Lie number 9, Africa is always at war. While conflicts exist, most African countries are peaceful and stable with growing economies and democratic governments. Lie number 10, Africans are not educated. Africa has top universities and Africans excel in global institutions leading in medicine, engineering, and politics worldwide. Let's spread the truth about Africa. Stay inspired, stay Africarized.
Yeah, stay inspired and stay Africaized. Africaized, meaning stay au fait with your own African history. As you know, the majority of us in the Caribbean region are of African roots and or descent. Okay, so be mindful of our link with the mother planet. Okay, so that was a bit of information that I feel is quite pertinent because we often hear, ever since I was a boy growing up, we hear only the negatives as it relates to Africa. Africa, the dark continent. Hello, caller.
Grand Rising, Quint.
Good day, and how are you today?
I'm doing great.
Well,
Thank you for playing that clip, Quint.
yes.
Today, Quint, we are rewriting our truth from their lies. And that's the global effect that is on the rise right now, Quint. Our African youth globally are out of the misery of believing, and we are now knowing. Everything, Quint, everything they told us in their books, like I said before, Quint, before blood and ink, before guns and barrels, we were a civilization that they have copied from, and they turn it against us by flipping the script, and they have lied to us. Quint, I'm not going to say much today because I'm more on the listening side, but I'm just happy that you played that clip, and I'm just hoping our people are listening, because the clarion call has been sounded. And like I said before, Quint, Africa is the present, Africa is the future, and Africa is the new earth. Africa is for all Africans globally. Our unity and knowledge of self will cripple the misery. Africa is on the rise. The Western world is dying, while the growth of Africa is the new earth, the new birth. Let us tap into what belongs to us, and let us take ownership of what is ours.
Are you aware of the happenings recently in terms of the Sahel states and their stance, and the fact that the U.S. is now seeking to make some form of negotiations?
Yes, Quint, I'm following it.
Well, that means
You see, the thing is, Quint,
that means you are more of it than I am, because I've only heard people say it. I've not gone and perused it myself.
yeah, Trump has sent some diplomats to have talked with the leaders of the Sahel, Burkina Faso, Mali, and Niger. You see, Donald Trump is playing both sides. He's not our savior and he's not our friend. And we have to be aware of this. He's playing both sides. His rhetoric in Davos, the way he insulted Europeans, let them do that. We have to be mindful and we have to be knowledgeable of the games that they have played. We have to wake up now. And this is what is happening, Quint. Because you see, unity and knowledge of who we are, it is taking shape in the Sahel region. Sadly, some of the African politicians are not following.
Well, hopefully they will join one by one. Though I agree with you, they seem to be reluctant. But I think they should follow, because the examples being shown by the Sahel states are positive examples. It's not to say that they are negative examples.
Well, you see, Quint, when Journey said that Africa is the future and the resources that we are entitled to, I was reflecting on what was played during our COVID, and I don't want to repeat it again. But you see, the West doesn't want us to reconnect. They don't want us to reconnect, Quint. Because you see, we cannot reconnect unless we are knowledgeable. We cannot continue to say that I am a Kititian, an Antiguan, a Jamaican. We are connected by DNA, Quint.
Yeah.
What they have done to us was brilliant for them, and it have worked for them. Once we are divided, Quint, we are manipulated.
But
They
let
don't
me-
want us to unite.
Let me ask you a question, okay? If it is, and I agree that it has worked for over 400 years. But why is it that in this supposedly enlightened era where you can just press your button, everyone has a smartphone or a smart computer or smart TV, and you could just press your button and get information, why is it that our leaders especially seem to be blinded and continuously allow themselves to be coerced and fooled into this? Why?
Well, Quint, like I said, I've moved away from going along to get along. Oppression has become comfort for our politicians. Don't refer to them as leaders, because they're not leading. Oppression has become comfort. The mind of the oppressor is trapped into their heads. And they are, and respectfully I say this, Quint, sadly but respectfully I say this, our politicians have become dogs of a king. This is an African proverb.
Yeah.
Oh, and I say respectfully, they have become dog of a king. I am no longer into going along to get along.
I heard a dog behind you protesting, you know what I'm saying?
Yeah, that's my dog, Quint. I think she's feeling the vibration.
Well, she just heard you
But
say
yes, Quint.
dogs of a king, so she's saying, no, I dare to differ on that, you know.
Yeah, I think it's a cat feedback in it. That's my domino. But Quint, the thing is, right, this is really sad. It is really sad. Our reality is our realization. Because, Quint, everything that they have imposed upon us is a lie. And that includes religion and their Christianity. Because before blood and ink, our African ancestors was in harmony with nature, the universe, cosmology, and ecology.
Yeah.
And that is what they learned from. I want to say this quickly, Quint. When they demonize our spirituality in terms of voodoo, and they call it witchcraft, I want to say this, Quint. When they call witchcraft, they were asking a question as to WHICH, which craft are you using with this ability that our ancestors had? Not witchcraft as in WITCH. They was asking a question. Which craft are you using that when we spoke things appear? But they gave us one deity, that God. They call God, that spoke and things appear. This was when spirit became flesh in the African man, divine feminine, divine masculine. I hope we understand this, Quint.
Yeah.
As in biology, spirituality descend upon the face of the deep, and it wasn't one deity. When you and your wife climax together, Quint, billions of sperms are traveling into that ferocious environment to enter the womb to create life. And the totality of life, we are an aspect of the Creator. And life is eternal, everlasting in procreation. There's no other evidence on this earth that life does not come from the womb of the woman. We have to move away from this Adam and Eve, the woman come from a bone of the rib. We have to move away from that, Quint, because that's only happened in a book, which was an experiment by those who were cast out. And their seeds are who run in this system today that have imposed misery on us, and we swallowed all of that wholesale. Well, today, we are waking up, Quint, and the sooner we wake up and unite, the sooner we melt the ice. The ice, Quint, that Trump just established this ice military into America.
We have
When
another.
we melt the ice, when we black people raise our frequency to resonate with the source, we control the SUN.
Another caller, Journey. So perhaps you can wrap up your point.
Yes, Quinn. Yeah, I mean, I'm really happy you played that clip, and I'll continue to listen, Quinn, and try and get back in later.
Okay, you take care. Hello, caller.
Yes, good morning, Quint. Good morning to the listeners.
Good day to
And good
you.
morning
And
to that
how are you
good morning
today?
to that caller. Yeah, pretty good, man.
Okay.
I'm happy. I'm very happy you played that clip. It's very sad to see what's going on in the world. And I'm going to use a phrase from Kalandri. We need to settle our differences. We need to stop attacking each other and trash out our differences. Let me put it that way, like how we normally say. We need to stop attacking each other and trash out our differences. Unity is the key. No matter what you say, no matter how you put it. We see what's going on in the world, man. And in our small little space of St. Kitts and Nevis, we are not moving accordingly. You know, there were some words uttered last week that seems to have the goal of putting a wedge between the Nevisians and the Kittitians. And that can't be right, not just for a person's political advancement. You know what I'm saying?
Yeah, I hear
You know,
you.
I'm of a certain age, and that person is of the same age like me. And yes, you know what you see, how you grow up. You know what I'm
But
saying? You're correct.
let me ask you a question. I hear you and I hear, what the individual might be trying to incite, but do you think it will work? Bearing in mind that what he's saying is not really completely true because he's suggesting that we are the ones who don't want development, but the Nevisians are the ones who started clamoring, and because they started clamoring, us across the waters picked up our ears and decided, hey, let's scrutinize that and see what it's all about. So, do you think it will work?
No,
Okay.
me I should have some optimism. And you see that Buckley's uprising, what happened in St. Kitts? I went to CSS High School on Nevis, and they didn't taught that in school when I was there. It's a reason why they're not doing these things. You see the 10 lies that you just pointed out about Africa?
Yeah.
What they want to do is make us believe something that's not true about our ancestral land.
Yeah.
And we fast forward to today, and we have our politicians trying to brainwash us. They're leading us down the wrong path. You know, there's so much stuff going on in the world. And then when I come back to something Sunday, because I love to do that, man. I love to come back to home and apply what I'm seeing out here in the outer world. And we are an island of two, St. Kitts and Nevis, and we should have that unity amongst us. You know what I mean?
Yeah.
And that is what should drive us, the unity. Okay, America, we have a president at the helm here in America right now. The man is a con artist, and the man is a convicted felon of 34 charges. And now he's trying to dictate the world. And we, in our little space in the Caribbean, we are signing on to this BS. Clint, I'm going to agree with you. You know where this stuff starts, bro? This stuff starts at that Sahel stage. We mainly concentrate on Burkina Faso and IBM jury, like it's normally said. But it's a federation of 3 states.
Yeah, it is.
And, yeah, go ahead.
No, I was just saying, yes, I agree with you.
Yes, thank you. And we have a federation of St. Kitts and Nevis, which is only 2 tiny islands. And we can't get it right in St. Kitts and Nevis up to now.
You know?
Man, I left St. Kitts and Nevis in 1985. I was disconnected for a while up until about 2013. since I got reconnected, I'm hearing and seeing the same complaints when I was a young boy in Cotton Ground.
Yeah.
And these politicians, they're not leaders. Some of us already start moving away from calling them leaders because they're not. We are seeing the whole region, all of the politicians in the region, they are bowing.
Imagine,
They don't have
imagine,
any.
imagine yesterday, Cortensia played a clip with one of our supposed leaders in the Caribbean, and the way he was sounding so pitiful, like almost like he was pleading, saying they don't want us to. They want us to get rid of the Cuban doctors and the best doctors we have right here, right now. Well, if the best things you have is benefiting you, well, say to the people who are telling you to not do it, tell them no. If you know you have an ailment and you go to the doctor and the doctor does your test and the doctor says, well, Burl or Quint, you have so and so and so, and unless you do that, it's going to be to your detriment. What are you going to do? Are you going to ignore it?
Yeah, man.
But he wants to ignore something that has benefited. All of us in the Caribbean region have benefited from the Cuban doctors. And tell me what kind of friend wants you to disassociate yourself from something that benefits you when all that they're doing, that friend is doing, is imposing on you things that are hurting you.
You see, we are being boxed in right now. You see, our politicians, they don't really care about the people. Man, it's starting to appear like there should be another uprising. But we may not be a violent people in the region, but we must at least exercise our rights to protest. When these leaders come to St. Kitts later on this month, we should go out in the street and show them that we are dissatisfied. I mean, no doubt about it, because we may not get that chance again. We may not get that chance again. Our politicians of the day, man, they are selling us out, bro. They're selling us short. They're selling us out. When you sit and examine all the stuff that's been going on, it's like they're literally giving away St. Kitts and Nevis. With all the monies that they pump into these entities, they are giving away St. Kitts and Nevis, no doubt about it. We are losing
Burl.
much different ways.
Okay, Burl, we're at that time when we have to segue into the next program.
Yeah, no problem, man. Maybe we'll come back in afterwards.
Okay, so...
Yeah, thanks a lot.
Yeah, you're welcome. I see another individual trying to engage, but it's that time. It's hour, and you know what happens at hour. And I'm going to play for you a rebroadcasting of Weekly Dose with the good Dr. Natalie Osborne. Do take a keen listen.
We're different. We're 98.9. 98.9. Win FM.
Better prices, better quality. Check Brown. Better shopping for you. Best value for your money. Check Brown. Better prices, better than the rest. Brown's the good food people. At Brown to get the best.
Grab a Vitamalt, a natural, non-alcoholic malt drink packed with health, energy, and vitality. Vitamalt contains important B vitamins. Do you want a healthy lifestyle? Then grab a Vitamalt now. Vitamalt takes care of you.
And good morning and welcome back to Island Tea. And you know, this is the time for a Weekly Dose, and we have with us in studio the lovely Dr. Natalie Osborne. And today's topic is habits that secretly annoy your doctor. So listen to find out, okay? Don't just take the topic and run away. Listen, and we can all learn today. Good morning, Doc. Welcome back.
Good morning, Cortensia. Good morning to everyone who's listening out there. It's always great to be here on a Tuesday morning. This is our meetup time, Cortensia.
Yep, indeed.
Yes, so habits that secretly annoys your doctor. It's not bashing on any patient at all. Ultimately, it's to ensure that we get the best out of the visit that we have with the physicians. So what physicians around the world have been saying is that your own behavior can get in the way of your getting the best and the highest care possible. So it is important that you go in with the right mindset. And so there's a low rate of physician satisfaction in recent days, and lots of physicians are leaving the clinical practice and going into research or other areas where they do not have to deal with patients on a day-to-day basis. This is why this is important. And there is a shortage of physicians, as the data states from the United States. Yes, and so in many areas you have a shortage of family physicians. And so hence your visit to your doctor is much delayed. Persons have a long wait time to get in to see their physician, get in to see a specialist because of all of this. So our discussion here today is not just to hurt or upset anyone, is to ensure that we get the best out of our visit with our doctor, because being a physician can be very overwhelming at times, Hortensia, and physicians are reporting lots of burnout. So how can you meet your physician halfway? So help them to help you. So that is what today's discussion is going to be about ultimately. So there's a lot of research went into this, so we're going to go right in and discuss some of these habits, Hortensia. And of course, you would be on the side of the patient, and then if you have any pushback, you would then make your comments known.
Indeed. Not coming prepared. I'm trying to understand that.
Okay, so not coming prepared. That is one of the biggest issues physicians complain about to the doctor. Your time is limited with the physician, so your preparation is important at that point. You want to have all of your necessary medical histories, all of your necessary drugs, whether you take an image of on your phone of the different medications that you have, okay, or you bring the containers or the labels with you so they're quite aware of that, okay. You want to ensure that you have a list of all your healthcare issues. If you were referred by a different physician, you want to ensure that you have any laboratory results, any ultrasound tests, because it makes your time there with the physician as effective and efficient as possible, because you know that you're coming in prepared. The doctor can look at all of your results and help to get to a conclusion in a timely manner and to be as effective as possible. So that is why coming prepared is very important.
Okay, and now that makes plenty of sense. My head hurts, my hand hurts, my foot hurts, but I can't pay for my stomach. I'm trying to cover too many problems all at once. How can you deal with that?
Yeah, trying to cover too many health issues at once. I want to ensure that our audience understand. You have medical issues and you have medical complaints and you have associated symptoms. For example, Hortensia, I'm having abdominal pain, and it might be an acute appendicitis. So you have abdominal pain associated with nausea, vomits, with fever. Those are associated and related. But that's not what happens at times. Patients come to see their physicians, and they want to cover everything because they haven't seen their physician in over 2 years. And they say, since I'm here, doc, I had a swelling to my foot 2 weeks ago, but it's actually gone now. And what about the chronic pain that I had? I had some pain in my back, and it is not related. Why can this be harmful? Because it distracts away from the main complaint. What if you have a true abdominal pain and you have acute appendicitis, but then you randomly mention that there was a swelling to your toe or you have a bump on your toe, and we get distracted? So we have to make the main thing, because patients can have their own agenda. And I said, since I'm going in here, I want to make sure I get everything out of the doctor, and I want to cover everything. That can lead to miscommunication and mismanagement. So you understand me on that one. So let's make the main thing when you get there.
But what would they do with all the other pains for those who Let's talk about lying about our medication and the habits. I know some people get medications from the doctor. They take one. It makes them feel funny. They don't take it anymore.
Yes. So in truth, your physician is not a mind reader. Okay, so for them to effectively care for you, you've got to be honest and give them as much detail about your medical history, whether it be your sexual history, whether it be whatever habits you have. It makes no sense to lie to the doctor. I often tell my patient, I'm not the police, I'm not here to judge, I'm not going to lie. But what exactly happened? Give me the facts here. Don't withhold, because if you withhold information from your physician, then your management can change. What if an individual, embarrassed to say they take a drug to help with the erectile dysfunction? If I'm prescribing a different medication, it's important, because what if it counteracts and there is an interaction that can be lead to some ill effect? We want to be clear on all these. All of your medications, all of your health symptoms. If you smoke, you need to let your physician know that. If you use alcohol regularly, those are things, though they may be embarrassing, we're not here to judge. We want to have a totality of the picture on the patient, so then we can help make the best decision and assessment there.
If I feel good, why should I come to regular checkups? Why are they so important? Why?
So avoiding regular checkups, Cartencia, because then that happens, and we mentioned it earlier, you want to pack everything in one visit. So when you have your regular checkups, your doctor has a good understanding of what's going on with you. It is not the same if you come in once every 3 years and then you have to play catch up. But if you're regular with your screenings, you're getting your mammograms ordered, you're getting your PSA checked, which is checking your prostate. You want to check any necessary screening tests that you know, checking on your blood sugar levels if you're diabetic, making sure that they're all in good standing. Instead, you come in once every 3 years, your doctor has to play catch up, has to do so much at once, and to get a picture or understanding of what has been happening in the last 2 or 3 years. So regular visits actually help, and you can address any issue or health condition as it arises and correct it.
Exactly. Slacking on our daily wellness habits. I don't want to eat good today. I'm not exercising.
You hit the nail on the head. Overall, I tell patients, and listen to this, that your physician is there with you most 20, 30 minutes for that visit. You have to live with yourself. The physician would advise and support, and that is our job. Ultimately, your health is your responsibility, so you take charge of it. How you eat, how much you exercise, what is your diet like, are you taking your medication, okay? So then patients will come to the doctor and they know, oh, I have an appointment on Wednesday. Let me take my blood sugar medication now, so that when she checks it in the office, it's normal, but you haven't been taking it for weeks ahead. So that little finger prick that we do and check the GMR, it's normal, and you feel good because the doctor saw that is normal. So but you are actually tricking yourself ultimately, because the uncontrolled blood sugar over that length of time is actually creating harm in your body. So it is important that you do not slack in your wellness habits.
Okay, well, I have this little thing here, but I have it for a good reason. But sometimes we're in the office with you, we're on the cell phone, we're not listening to you. And you say something, yeah, but we're busy texting back to somebody, playing a game, doing whatever.
Yes, and it has happened often in the office. The patient gets a phone call and they have to take it, and they distract the conversation. What happens then? Once you get off the phone, you've lost your train of thought as the patient, and then we're trying to play catch up, and something important would have been missed. So at that time, if you're in the waiting area, you can be on your phone, but you put it on silent, and once you start having that dialogue, it is both respectful on both ends, that there is clear communication, there is a listener, and there is someone who's talking, so the communication can improve. So you want to leave that cell phone aside once you're visiting with your physician.
You think we should put up signs that says, put your phone on silent before you enter the doctor's office, just like how some institution has? up something like that?
Yes.
Or that might be too harsh for people?
No, well, even if you're waiting in the waiting area, you should have your phone on silent. If you're playing a game, if you're looking at something on social media, have your headsets in so that you don't distract. You remember back in the day, you had the magazines in the waiting room. They no longer use that. Everybody wants to know if you have Wi-Fi, they want to log on, and they want to use their social media as they wait.
I went to the doctor's yesterday, and the office had a sign that says to have the cell phone.
Yes,
level. Yeah, because I guess
it can be distracting to others.
It certainly can be distracting. Alrighty, so let's talk about seeing you in public and say, Doc, you could tell me what's wrong with me. This is what's going on.
Think about that. We're in the supermarket, and it has happened to me many times. And I'm just going along the aisle, and a patient comes up to you, an individual. I said, Doc, I was supposed to come by you, but look here, look at the swelling in my hand. What do you think it is? Can you tell me? And then what happens? That could be very detrimental. One, and I like to tell patients, the streets is no place for consultation. One, the doctor is giving you an off-the-cuff comment. And you can run with that and take that as a diagnosis, and then you do not come in. And if later it turns out to be something more severe or something detrimental, what is the patient going to say firstly? Oh, well, the doctor had said, but there is no documentation. I like to tell persons, come in so we can sit down and have correct documentation. All right, so that is not the place to stop the doctor and say, Doc, what you think? My daughter was having some earache and something, and it happens. And we're humans as well. We may need a little downtime, so the supermarket or the parking lot is not the place for that.
Okay. Let's talk about bypassing and disrespecting the nursing staff. I know sometimes we have some rude nurses. Yes, I said it. But why should we not disrespect them?
Because they're part of the healthcare, and they're healthcare providers in their right. It's not just physicians. And persons may sometimes think because they're nurse, they're underqualified. That is not so. They chose to be nurses. It is a calling. It is a passion for some persons. And you've got to think of the healthcare like this. It's a continuum. The physician is not there 24 hours of the day. So your nursing staff continues, and that is why that is important. And I said this, Hortensia, because this one is important. I've sat in my office and had patients call the office with a complaint, but have not gone to the nursing station and addressed the complaint. And I said, no, the nurses are there. You need to first speak to the nurses and let them correct whatever the issue might be. The nurses are very intelligent, so you need to ensure that you communicate any complaints so that that can be taken care of. Or else your doctor can become overwhelmed, hence the burnout, because there are lots of issues that the nursing staff can deal with that do not need to get to the level of your physician at that point.
I'm sure some patients might say sometimes the nurses don't make you think they're approachable. Like they have on faces that you're frightened to go and even ask a question.
I do not think so. But everybody can have an off day, Hortensia.
Yeah, I know. Okay, pretend to be clueless as to what's happening to you. Like, I don't know, I don't know.
No, well, that's not that one. This one that speaks about pretend to be clueless. This is a very interesting one, and I've had it happen to me. So, for example, I'll use you. You come to see me with your mother. So your mother is the patient, Hortensia, and we're having a dialogue. We're discussing her complaints. And then you say, well, Doc, Sister here, by the way, what's going on? Look at this thing on my foot. I've been having it for several months now. Look at this rash. What do you think? And they essentially are inserting themselves in the mother's consultation and taking the attention away from her and asking for a consultation themselves there. Almost like a 2-for-1 if you think about it like that. And that it also takes away from the main issue at hand, okay? So since I'm here, Doc, look at this thing for me, similar like when they stop you on the streets.
Oh, boy. Let's talk about exaggerating symptoms as the patient, I would say, to get the doctor's undivided, full attention. Look at me.
Okay, and I'll let you hear this one too. Persons often come to the physician, and if you are very observant, you can see them in the waiting room, you can see them before you approach them, and they're laughing, they're talking, they're having a good time. And as soon as you get close, the symptom that a complaint. So we use a scale from 1 to 10, abdominal pain. You say, Doc, you ask, well, how intense is the pain? You say, Doc, it's a 10. But their demeanor, their behavior does not illustrate that it's such an intense pain. And there's often a secondary gain, a cartensia. But we have to be careful because it's the boy that cries wolf. Yeah. And I'll give you this because this has happened to us before. I haven't worked in the emergency room for years, but when I did, patients back then, when the waiting area was full, so you're with me, when the waiting area is full, these individuals will go back home and call the emergency line and call the ambulance so to come for them and bring them in the back because you're thinking as a patient in the emergency ambulance, you would be attended first. Yeah. And those things are not correct to be done because it can be misleading and you can create problems overall for your health care because if you exaggerate your symptoms for secondary gain. I've seen young females, they have their partner there and they want to pull him in with their emotions and they're being ill. What if he was trying to break up with them? No, I'm sick. He has to put that aside. He has to pay attention to me. There's a secondary gain, so we have to be careful. This is not the time to play around. So if your pain is a 6, say it's a 6. Be very specific and precise, because what does that do? Avoid unnecessary testing, avoid unnecessary intervention when they weren't warranted. Okay? Exactly. So honesty is always going to be the most important here.
Let's talk about waiting. I don't understand. Why do we get appointments when they don't match the time?
Cortensia, that's where we would have to take some responsibility, but lots of things. It's a two-way stream. Remember, it takes two to be involved in any communication, any relationship. Yeah. So you're in the waiting room, and a patient comes to me, and I remember having this discussion. The patient said, fussing and started saying, Doc, I was out there so long, something. I asked, so what is that room called? He said, what do you mean? I said, where you were sitting, what is that room called? Then he seemed like he caught on, because it's the waiting room, so you should wait. So he was upset. But I'll give you the other side of it. There are times you can't help, because a consultation might be a little bit more complex, and each person may be different. You can pick up time with a person that comes in, prepared. You can save time on that. The person who've had regular checks, so when they're coming in today, it's for something specific and not and something that could save time. But you also have to remember, as a patient, when you come down, you've got to remember others are waiting. Cortensia. Because once you sit down, you forget that there are others and you want to go on and you want to share everything with your physician and you want to get all of the psychological support, which is important, all the counseling that you can get. But you've got to remember that it works both ways. So you've got to think about your fellow men who are waiting outside as well.
Yeah. Oh, boy. Oh, this one is a rough one, and I even hear it from the wax text. Not clean up. Well, you didn't clean up before you come see the doctor. So let's say you're on the construction site. You come in your construction clothes to visit the doctor.
Well, I don't want to pinpoint any particular group because the construction workers not necessarily so. But
I was just trying to find the group that would have the most on them.
Think about it, Patrick, also. We've had situations, and it happens in the institution as well, too. So you're working in the hospital. I go to do rounds. But I want to take you back to the time of old Cortensia and Patrick. Back then, what happened? The nurses would get the patient up. The patient would get tidied up at 5, at 6 in the morning. So when the doctor starts rounds at 8, they were fresh, and they would have a good conversation, and the doctor can examine, evaluate the patient. Persons are not doing so now. They're not willing at times. If the nurses would say, go and take the morning bath, they're still sleeping because they stayed up late, and they do not. And so you go to a patient and you're supposed to examine them, and they're unkept at that point. And it makes your examination very difficult. You also remember, I remember as a child, when you went to the physician, you would dress in your nice little church dress and your nice hard shoes. Do you remember that?
Yeah.
It was always a pride so that you tidy it up. So what we recommend, you take a bath as close to your official time. If you work and you ask permission to leave the office an hour before so you can go home if you live close by and tidy up. If you can't, there's all sorts of different wipes. You try and tidy up as well as you can, so that when you bring a change of clothes, a change of underwear in your work bag, and you can do that because it shows that you respect the physician and you also respect yourself when you go for that visit.
I'm guilty of this. Self-diagnose.
Self-diagnosing. Almost everybody comes into the office with already a preconceived diagnosis. Here's where we can go wrong with that, because persons Google their symptoms, and Google follow your algorithm, and it could take you down that bad path where you're thinking that even the simplest symptoms, the mildest of symptoms, you may think that is something much worse. And you come into the evaluation with your physician, your anxiety is heightened, you're all stressed out, you're worked up, and then you almost force your doctor's hand to order unnecessary testing, unnecessary evaluation, because what? You are so worried about something that just might be something mild or something benign or non-cancerous, and because of that, you may make that the visit go downhill basically and create lots of, because sometimes you go to a physician and you say, Doc, I feel this thing, what you think, whatever. The doc may think it's just a muscle spasm or muscle cramp, but because you've heightened yourself, oh, I'm having a heart attack, you've made that such a fearful thing. Now you have to do an EKG, you may have to do an ultrasound of the heart, we call it an echogram, and that thing can make it much more complex. So we know you want to be the informed patient, and it's important, but you don't want to self-diagnose. Also, it is bad because you come in with a preconceived diagnosis and you want to insist that the doctor treat it in such a manner. And what if that's not so? Okay, and you can create this whirlwind and you spiral out of control, and then you have a misdiagnosis because you came in with already an idea. So you got to keep your mind open in the visit and be receptive as well. You can also challenge. We're not saying that you can't challenge, because you have to be your advocate, but you've got to also come with an open mind.
Okay, so
yes.
Don't come with your own self-diagnosis. I like to go to Dr. Google and find out.
Yeah, so Patrick, any thoughts on what we've discussed so far?
Well, in listening to you, I realized that even though you're a doctor and I'm an electrical engineer, that there are similarities in what we do. For instance, I'll show you. Recently, I went to a transmitter site, and we had some problems there. And the individual who normally works there, he was not too afraid with everything. But after testing the equipment, I realized that the STL was okay, the transmitter was okay, but some rain had fallen. And I knew that, well, if the transmitter is okay and the STL is okay, then it means water is in the cable.
Okay.
So I was able to do that analysis. The same way with a doctor. The information given makes it easier to do an analysis and come to a positive conclusion.
I like that. Excellent, excellent. I like that. So that is why we speak about speaking clearly, coming prepared, and making sure you give the facts. Okay, without any fear at this point. And I like to emphasize, your visit should be confidential. Your visit must be confidential, because you have to be able to relate everything to your physician concerning your health.
Okay.
And that is part of our oath of standard and being ethical, okay?
Okay, good stuff. So let's talk about the patient side. It's all about the patients now. So I'm going to read the heading first. Habits that annoy most patients about doctors. Looking down on patients. When they say looking down, what do you mean?
Okay, no patient, sorry. So I'm on the side of the patients with this one. Likes to be treated like a child.
Okay.
So remember, the doctor spend years studying. Sometimes they see a patient and the patient may be a farmer. In whatever profession they are, they may think that the person is simple or less than. And you have to be careful with that. Okay, so you have to speak to the patient with respect and with clarity, and not just brush their symptoms off or minimize anything. So give them the facts, but break it down. You don't have to use all of the medical terms, but break it down, make it as simple, but make it clear so that the patient can understand. And do not withhold anything thinking that the patient doesn't have the intellectual ability to understand that. So that I would encourage all of us as physicians to do.
Some of us went on Google. How about being difficult to reach? Because you know, sometimes we're trying to reach our doctor, and we can't reach our doctor, and we call the secretary, and the secretary gives us a runaround, and then we try to call our doctor again, and we can't reach our doctor. How can you put our minds at ease and help us to not worry so much?
Okay, being unable to reach your physician. The physician, okay, you want to have availability to your patient. And we, as physicians, we at fault at times for that. We do the proverbial being busy. But we have to have discipline in this profession. This is a high calling. If you tell your patients that the office starts at 10 or 11, you should be there. Unless they're very extenuating circumstances where you're unable to. It doesn't mean that the doctor gets an out by saying, oh, I was busy. Oh, I'm a physician, I'm busy, I was there. No, you have to plan your schedule and plan your time accordingly, knowing that you have an obligation and a responsibility to the patient. So that is being available and accessible to your patients. But they are office hours, so at times you may not be able to get the physician at all hours after. I recommend, if there is an urgency, an emergency, we have the hospital. You can always visit there and you can mention, oh, I was seen by Dr. Osborne today and she suggests this and this, but when I went home, this happened. Is it possible you can reach out to her? Even the physician who's there can reevaluate you. That would be my best advice in our setting, since the doctor's office is not going 24 hours a day.
All right. Oh boy, sometimes we think, you're not hearing us, you're not listening. Okay, let's take the call. Caller, good morning, you're live on Weekly Dose.
Good morning to you and your guests. The doctor mentioned something there, Matt, that may have sounded a bit conflicting. Basically, when you go to the doctor for a particular ailment, you're not supposed to distract the doctor with other things. But isn't collecting the history of the person just as important? And shouldn't you distinguish between a visit to the doctor for an ailment as opposed to going for a checkup? Because, I mean, I've known a physician who, when you go to him for an annual checkup, would ask you things like, have your foot, your shoe size increased? Are you happy? You know, things like those, which normally one might find outside the realm of well, from a layman point of view anyway, outside the realm of medical stuff. So does that conflict in not trying to distract the doctor with side so to speak?
Okay, I like that question. Thank you. I like the gentleman's comment. Two things can be true at once. There is your annual physical, too, and when you come in for a specific issue, all right? So we can separate those both. Okay, because the patients have come and said, Doc, I'm here for my physical. And then you do a thorough review. And that question that the physician asks, if your shoe size has changed, that tells you, do you have swelling to your feet? Because if this patient, because it all ties in, is this patient hypertensive, have high blood pressure? Could they have any signs of heart failure where they're retaining fluid and they think? So that makes sense. So all these are ways that a doctor can communicate to a patient. That is important. When we spoke about having too many complaints, having too many complaints at once, that was that we may miss the main thing, and we still have to be careful about that, because we do not want you to be having chest pain and an MI or a heart attack, let's be frank, and we are focusing that you have chronic arthritis and your knee is hurting. That's all I want to make that distinction is. So we focus on the main complaint. We know that there's secondary complaints, and hence one of our discussion was also having regular visits. We mentioned that as a point, so that you do not try to throw everything in one visit. Hence we may miss things, and we do not want to. So having your regular annual visit with your physicians and your check-in, it helps us to stay a track of everything. Because when you come in, for example, once every 2 years and you're hypertensive, you're diabetic, you have high cholesterol, then it's a whole lot you have to deal with at